Kia ora, my name is Whakakotahi. I'm from Tūhoi, Children of the Mist. I got involved, my partner had diabetes. I didn't know anything about diabetes, nothing. And then when my partner died through diabetes, I was sitting at home and I get a phone call. Veronica, I went, oh, here we go, somebody wants me. And it was Mary. Mary got me involved in this diabetes program. I was only taking it upon myself because I didn't know about diabetes, and I was so sure there was a lot of Maori people and Pacific Islanders that didn't know anything about diabetes. So I got involved with it, and I'm glad, not realising that I was one of them that had diabetes.
I'm Imelda Sayuli. I'm from Pumare community. I'm here today to join one of the diabetic program, and I love it to be leaning on diet, exercise, and to help with my family and some of the community. So I get involved for walking, exercise, diet, help around the koha at Pumare community. I just love it, and help with my grandchildren.
My name is Kamal Chandra. I have been involved in Toiora, this patient group, since 2017. Most rewarding part was that I have learned so much from it. And it has given me so much encouragement that I have pushed myself to learn more and more.
I'm Anthony Pairama, aka Toi. I get involved with this program because my daughter works up there, up at HUCHS, the doctors and stuff, and she wanted a guinea pig. It's the information that I want that's in this program, and and people ask me questions, I will give the answers that I've seen with my own eyes.
I like to see more about what the groups we've got now. The group that we've got now was it'll bring more people in to understand the diabetes and understand how to cope with it.
I will also like the professional to be more easy language can be used to understand.
Well, I think they've picked up a couple of things. Actually listen to the patient, or jog the patient with asking them more questions.
I sometimes don't understand doctors or nurses or the health side of it, because a lot of our Maori people and Pacific Islanders, they go to doctors and all the doctors do is give them pills, but they don't know what for. But I've never known any of our Maori people or Pacific Islanders ask, why? Why do I have to take that pill? Why do I have to do this? Instead of sitting and explaining it quite clearly and in our language, not their language, these high words that, what doctors use. As a consumer, I think they need to explain more clearly to the, well, I'm going to say patients, clear properly what it means to have diabetes and what to do about it. And just listening to what they're trying to tell you, you cannot force on a person. If you're sick and that, you cannot go and say, look, you're not allowed to do this. You've got to explain it why you can't do it. Not that you can't do it, but explain why you can do it.
The highlight for me is just to be light the candle out into other people. As I light the candle, need the light for myself first, and then I do it share around to other people.
I like to be a voice so that people can understand, and that's what I feel I can give out, is information, but in simpler words. My way of looking at changing was my family, because we're all sweet eaters. They didn't care because they thought having exercises and all that was good for them. They had no sicknesses. So when I told them that I had the sickness, that sort of woke them up.
They just tell me they're big bone people, and I remind them, well, I was a big bone person too. In the year 2005, I was 186 kg. Only 89 now though. The people that have gotten themselves involved since we started this are the people that, you know, they grew up with me and I was a little fat dude. And because they see me losing weight, and it's not through, you know, those other things, pills and stuff, you know, I told them, you know, all you have to do is walk. And of course I talk to my doctor. The rest is up to the patient. You know, we can only offer each other information and work on that. Yeah, I kind of do that with my neighbours. You know, it's only because they've seen that I have lost weight and they're still big. And, you know, I picked up more new friends as they, you know, we went walking for a month or two. And we've been doing well. I'm a bossy little 5'6" dude. You know, and I talk well. You know, so, and they can understand it. I talk to people so they can understand what I'm talking about.
Well, involved in this project has encouraged me. It's more like a hunger to go out there and make some changes. This was the reason I'm also on the DHP Consumer Advisory Council now, to understand the principles of the consumers out there and their requirements. The best way is for the consumers is to speak out. Speak out with your GP, speak out to your specialist if you are in that category. Just go and speak up. Let your GP know exactly what you're going through, because GPs are learning from you as well.